Hello and welcome to today's video. Today, I'm going to walk you through step by step exactly how to find out how much mold toxicity your body is currently holding. And you might first of all think, oh, well, I've already done a mycotoxin panel urine test, so I already know how much my body's holding, but that's actually not an accurate measure of what your body is holding in its deep tissues. And the reason that it's so important to understand this is if your body is holding a lot of mold toxins in your deep tissues, as your body is slowly detoxing these substances over the years that it takes to do this, it's almost like you're being exposed to mold toxicity the whole time this process is happening. And this can be really frustrating or really scary if you're still having mold symptoms, but you think you're living in a safe environment. It can really make you doubt yourself. It can almost make you feel like your environment is gaslighting you because you thought you were in a safe place, but you're still having all of the symptoms associated with mold toxicity. But today I'm going to help you understand why these symptoms might be persisting even in a safe environment and how we can actually test inside your deep tissues to get a real idea of how many mycotoxins your body is actually holding onto. So let's get started straight away. So the way that we're going to be doing this is called a challenged mycotoxin urine test. This is different from a normal urine test because when you do a normal mycotoxin urine test, you're just measuring what is in free circulation, what your body is voluntarily detoxing or what your body is detoxing from what it's been exposed to on a daily basis. Now, this can be a really good way to assess if you are exposed to a mold toxic environment. And this is the primary way that people use this test, usually, especially if you're in a household where multiple members are sick, which is very common in mold toxicity. You take the sickest individual, so this could be the mom or one of the kids, whoever has the most symptoms and is the most dysfunctional, and then you run the test on them, and then that gives you a really good idea as to whether there's some environmental exposure. Then you can go deeper into testing the environment or testing the other individuals in the family. This is a better way to save a bit of money instead of just ordering like 4 or 5 tests all in one go. But what we're using this test to do now is to test the deep tissues. So you're not going to get an accurate reading as to how much exposure you're getting in your current environment. So if you do this test and it comes back with a very, very high level of toxicity, it doesn't necessarily mean that you're being exposed in your current environment. Because what we're basically going to do is we're going to add 3 lifestyle factors, 3 different things that we're going to do that actually encourage urinary mycotoxin excretion by an enormous amount. We're talking like 500 to 1,000% more excretion. And this is going to help us really see what's stored in these deep tissues. And one really cool side note, one really interesting thing for you to know is that if we're using these 3 modalities to increase the urinary excretion so that we can test what your levels actually are, then it also means that these 3 things are really good things for actually helping your body remove mycotoxins in the long run. So these are actually 3 very powerful detoxification methods that after we've tested to see what your levels are actually at, we can use these modalities to actually help the body remove these toxins from this deep storage. So let me walk you through exactly how we do this. First of all, we need to find a good provider of a mycotoxin panel. Now, in my experience, there are 3 providers that I really like for this. We've got Vibrant, we've got Realtime Labs, and we've got Mosaic, also known as Great Plains. These are my 3 favorite labs, and the reason that I have a bit of a variance is I work with clients all over the world, and some of these are more accessible in different areas versus others. For example, Realtime and Mosaic tend to be more common for my American clients, and Vibrant tends to be more common for people in Europe. But these are all really good options, and I'm sure there are some other good ones out there. But if you wanted my recommendation, it would be use one of these 3. And once you use one, if you're going to continue to test, because one of the things that you can do is you can keep doing these challenge tests every 6 months to a year or so. And what you would hope to see is that over time, even doing the challenge test, your levels are decreasing over time. This is an indicator that your body is clearing this deeply stored toxicity, which is ideally what you want as a long-term healing. So whichever one of these you go with, just stick with them, because changing labs, like if you do one with Vibrant and then you do one with Realtime and then you do one with Mosaic, that can skew your results a little bit because all labs test things slightly differently and they have different levels of sensitivity. So it doesn't really matter which one you pick, but once you pick one, I'd suggest that you use this one for all of your testing from then on, if possible. Now I'm going to walk you through the step-by-step procedure that you're going to do to make it so that when we do test for these toxins, that we're actually measuring the deeply stored toxicity, not just the surface level environmental exposure toxicity. So first of all, we're going to conduct a short-term prolonged fast. So this is ideally somewhere in the range of 24 to 36 hours. If you're in a spot where, so obviously we're talking about mold toxicity here. Mold toxicity can be absolutely devastating. It can cause chronic fatigue syndrome. It can cause lots of food sensitivities, malnourishment, blood sugar problems. If you're in a more fragile state, you could potentially consider skipping this one or just go with the 24 hours. If you're a little bit stronger, if you're a little bit more robust, or if you've done some short-term prolonged fasting in the past, so you know you handle it okay, go for the 36 hours. If you do go for 36 hours, you are going to get a more accurate reading on the deeper stored toxicity, because as you go for a longer period of time without food, it's going to encourage your body to go into a deeper state of detoxification and to mobilize toxicity from the deeper storage sites. So if you can do 36 hours, it is better. However, 24 hours is sufficient. You will see a significant increase just from doing 24 hours. And if you can't do that for some reason, it's okay. You can skip this step and just do the other two instead. So if you're going to go with the 24-hour fast, you want to do a breakfast to breakfast fast. This means you wake up on an average day, you eat your breakfast, and then you don't eat anything for the full day following that. And you want to take your urine sample first thing in the morning before you have your breakfast the following day. If you're going to do a 36-hour fast, we're going to do an evening to breakfast fast. So let's say, for example, we're going to take our sample on a Saturday. We're going to take our sample on a Saturday morning. What you would do is you would eat dinner on Thursday, then you would go to sleep, you'd wake up on Friday, you eat nothing for the full day. So nothing all of Friday, you sleep, and then you wake up Saturday morning. That is when you do your sample, and then you break your fast. So this way you're going to be at about 36 hours fasted when you are conducting the sample. The next thing that we can add to this that's going to help to boost the urinary excretion of mycotoxins even more is some sort of heat exposure the night before we take the sample. So there are a couple of different ways you can do this. The two best in my experience are either using sauna or using some sort of like a hot bath. Now, as long as you're increasing your body temperature from some external means, it will work. So what I mean by this is like exercise won't have the same effect. We really want to be increasing the body temperature by putting it in an environment that is hotter than the temperature of the body. So for example, the sauna, you're getting in a room that's really hot, and in a hot bath, you're submerging the body in a very hot liquid that's going to increase the body temperature. Doing this significantly increases the urinary excretion of mycotoxins. So when we do this the night before we take the sample, when we wake up in the morning and we take that sample with the first morning urine, the level of mycotoxins is going to be significantly higher. And especially if you're combining these two things. So you're doing the 24 or 36-hour fast, and then you're having some sort of heat exposure the evening before you go to bed. These are going to have a multiplicative effect where we're really pulling a lot of this toxicity from deep storage. And finally, the icing on the cake, the one extra thing that we can add that can increase the mobilization even more is glutathione. So I'd be looking at taking a liposomal glutathione supplement. We'd want to be taking, there's a variance, there's a range, but I'd say roughly about 1 gram would have the effect that we're trying to achieve here. And we would want to take this also the night before we take the sample. So you'd want to take this before or after having the bath. This way we're boosting your glutathione status, and glutathione is one of the primary antioxidants that helps us remove mycotoxins from the body. So what we're doing here is we're creating an environment that is signaling the body, you have everything you need, and you have all of these environmental factors that are upregulating your ability to clear mycotoxins. So pull them out from the deepest storage that we possibly can and mobilize them. And in that mobilization, the majority of these toxins actually leave the body through the liver. So they go and get packaged up by the liver and put in the bile, but a smaller portion is excreted in the urine. And we can still use this smaller portion that's excreted in the urine as a very accurate way of measuring your overall toxic burden. So even though there's way more toxins leaving through the bile than there are through the urine, it's much harder to measure it. in the bile, because the bile is in the digestive system, right in the top part of the digestive system. It's much more difficult. So measuring the urine makes it much easier, and it's still a very effective way to get an accurate read on your overall systemic deep storage toxicity. So I'm going to do a very brief summary and walk you through this full procedure in real time, so you know exactly step by step how to do it. So as I said before, let's say we're going to do the sample on a Saturday morning. What we're going to do is we eat normally on Thursday all the way up until the end of the day. We then go to sleep and we wake up on Friday and we don't eat anything for the whole day. So we're not having any food whatsoever. Towards the end of Friday, we're going to take a really hot bath or do a sauna session. So for the ideal time frequency, we're talking between like 15 and 25 minutes. The sauna tends to be significantly hotter than a hot bath, so you don't need to do it for as long, but let's say roughly 15 to 25 minutes is about ideal. And we're going to take our glutathione just before or just after going in the sauna or the bath. Then we're going to go to sleep. We wake up on Saturday morning, and when you wake up, in that first urine that you want to let go, so obviously being in a fasted state, your electrolytes are changing. There's going to be a lot of stuff going on. We want to make sure that we take the sample from that first morning urine, because this is where the most toxicity is going to be concentrated. And from here, you can basically just follow the instructions on the lab test that you went with. So whether you went with Vibrant or Realtime or Mosaic, whichever one you did, they have basically step-by-step instructions. At this point, you can basically just follow these instructions. So usually the way this looks is you want to go to the toilet, you let about half of your urine go. So you basically pee about half of your urine out, and then you take a small sample from the middle of the stream urine, and then you let the rest of the urine go. And that part of the urine from the middle of the stream, that is a really accurate measure on the organic acids and the toxicity that is being released from your body. Then you just package that sample up, send it off to the lab, and when it comes back, make sure you mark this as a challenged test. Because if you show this to a provider, or if you're just looking back at your tests like in 5 years from now, and you don't know that it's a challenge test, it's going to completely skew all of your results. So make sure that you mark it down that it's a challenge test, because it's very different. I think you can hear from how this whole process works, you're going to get a very different result from if you just did a regular mycotoxin test versus adding in all of these additional steps to challenge the body to release the stored toxicity. So the reason doing this is important is I've worked with hundreds of people that have mold toxicity, and they come to me and they say, look, I did all the binders. I've been cleaning all of this mold out of my body for a year. I've been doing all of these different things, and I'm still experiencing all of these symptoms. And I say, okay, but have you ever done a challenge test? And the majority of people haven't. And they think they've been doing all the right things because they've been doing the binders, they've been doing mold protocols, they've been doing all of these things, but they haven't actually been mobilizing the toxicity from the deep storage sites, which means you can take all of the binders, you can do all the things you want, but the mold toxicity is not actually moving out of where it's been stored. And this gives us a really good snapshot to show how much your body's actually still holding. And then consequently, if you are experiencing symptoms of mold toxicity still, which for most people in this context looks like significant deficits in energy, just generally not feeling good, cognitive decline, so just brain fog, brain not working very well, adrenal fatigue, very common, and often, very, very often, a lot of different types of digestive problems, chronic treatment-resistant SIBO, reflux, just anything in the gut, basically, constipation, diarrhea, it really doesn't matter. Any digestive problems, very, very connected to this sort of problem. So doing this challenge test is really helpful because it actually helps you to see that you think that you've cleared all the mycotoxins. And especially if you've just been doing these regular mycotoxin tests, not these challenge tests, the thing is your body has got to the point where it's just not mobilizing this toxicity anymore. It's just holding it. And that's not good. We need to make sure that we're getting it out. So doing the challenge test helps us see how much do you actually have stored. And then this can kind of refresh our perspective on the situation so that we can reprioritize this, because if mold is a part of your chronic health presentation, it is really hard to do anything with mold still there. It's really hard to fix the gut. It's really hard to heal SIBO. It's really hard to clear chronic bacterial or viral infections like Lyme or EBV. You always have to clean the terrain first before you can clean the germ. You have to clean up the terrain. And if your body is full of mycotoxins and it can't remove them for some reason, you're going to struggle. You're really going to struggle to make progress. So It's really important that we get an accurate assessment of what's going on here. And just to give you an idea, I've done this with a dozen or so clients, and almost across the board, their mycotoxin levels were decreasing, or they're just level, and they look like they don't have mold toxicity anymore. We do the challenge test, and their levels come back like 2, 3, 4 times higher than the highest that they've ever seen them before, even when they first started doing the detoxification process or on their mold healing journeys. So it's really important to do this if you've had a mold exposure and you think that you should be healing much faster than you are, and you're still dealing with a lot of symptoms and you're not sure why. It's really important we do this just so that we can rule it out. But for the vast majority, 9 out of 10 people, they think they've healed from mold toxicity, and they're actually just holding all the mold toxicity still. It hasn't really budged. So let me know if you have any questions about this specific topic. And if you feel like you need some help with working through a mold toxicity situation, this is literally my life's work. I did this myself. I've been through this whole mold toxicity journey. I've made an amazing recovery so far. I still have a couple of steps to go, but I cannot even compare my life to what it was. I was just thinking the other day, we just bought a homestead in northern Portugal, and I was pressure washing with one of my hands, and I'm just doing like this with the pressure washer. And I can remember back when I was really, really sick, this autoimmune arthritis that I had in my wrists. Like, I tried to wash dishes, I was trying to wash a cup like this, and it literally felt like the inside of my wrist was full of broken glass. And I tried to do this like 5 turns to clean the glass. I had chronic pain in my wrist for 2 weeks after that. And just thinking, like, I was just using a pressure washer, which is like a lot of force, and I'm just using one hand to do it. And I've got muscles, and I've gained my weight back, and I'm just so healthy, completely different person. So I've been through this. I've worked with hundreds of people to help them with mold toxicity as well. If you're dealing with this, if you want me to take a look at your testing, if you want me to try and play health detective and go through your current health presentation and help you figure out, is this something that you need to consider? Is there something else that we should try first? If whatever it is, if you need help, shoot me an email, support@williamdickinson.co.uk, and we can look at arranging a consultation so that I can dive into this with you in even deeper detail. But either way, I hope you found this really, really interesting and helpful. And as always, if you have any questions, just stick them down there. So take care, and I'll see you in the next video. Bye-bye.